What's up, guys? I hope you guys are doing good. I wanted to just come on here and have a really quick chat, with Charles regarding a quick topic, healthcare fraud. Let's talk about healthcare fraud. So today is August 31st, 2022, and we are here in Dallas, Texas, and there was a indictment that was given for a hospice that basically did not do things well. They did not take care of patients. They did things unethical. They did things that were actually extremely bad and should never be done in healthcare. And because of that, they were indicted, and I think 13 or 14 people were sentenced to prison. There were doctors, nurses, healthcare workers, and it's really sad. So I wanted to talk about that, and I wanted to talk about something that we talk about here at Charlotte Health Services a lot, and that's his integrity. And so I think one of the things the reason why people get into healthcare, number one, is because they care, right? They go into healthcare because they have a desire to help someone and to help them because they care about that person, right? And that's the reason why anyone goes into healthcare. And one of the things that I've just seen over the years is that healthcare as a whole, is broken, right? Everything is broken. Not every industry is perfect, right? Because we're all not perfect people. But when it comes to specifically healthcare and the things that we see like fraud, the things that we see like not enough reimbursements for insurance for patient care, you notice that, there's still some good in the midst of bad things. And I just want to talk about why people get into healthcare and making sure that you stay true to that. Because fraud is bad, right? Fraud is not something that you want to do. And I think a lot of times people go into healthcare because they care, but then they lose sight of the things that continue to drive what you do day to day. And so I just want to talk about just three things that really help people to avoid fraud and stay true to why they got into healthcare. Number one, always patient first. What is the best thing you are doing for that patient? A lot of times when people make decisions, if they err on the side of fraud, they think about themselves, not the patient. They think about greed. They think about how can I cut corners to make it easier for myself, not the patient. Remember, you went into healthcare for patients, right? Not for yourself. If you went into it for yourself, you're not gonna last, right? And so one of the things I always want to remind people, and this is the one thing that I want to just say, is that patient first. That's number one. Number two is excellence. And what I mean by that is every healthcare industry has different sectors. You've got the hospital sector, you've got outpatient, you've got home health, you've got hospice, right? You've got skilled nursing facilities, assisted living facilities. You've got so many different areas of healthcare. Within that sphere, when you don't know the regulations, when you don't know what you are responsible for in terms of your license and your industry, and you don't become an expert and focus on excellence in that industry, you're susceptible to fraud. You can't go by what someone says. You can't go by what hearsay, this person says this person says. You can't depend on that. You work too hard for your license. You work too hard for the care that you're rendering daily to be taken away because someone said something and you yourself didn't know the regulation behind that. That's your responsibility. So excellence is key. You've got to do things with excellence. Don't cut corners. If you're responsible for this patient, you need to know what your requirements are, what your regulations are based on your license, and what the agency's regulations are for that patient. And you need to know it. It's your responsibility. It's not anyone else's responsibility. It's not the company's responsibility. It's your responsibility to know what you're supposed to know regarding that patient, because that is your license. That's who you are. Not only that, you represent, you represent yourself when you're out there, either in the office or in the field or taking care of a patient at the bedside. You represent yourself. So you need to do things with excellence and make sure that you're doing it right. So number one was what? Patient care. Number one, patient first, patient first, patient first. Number two, excellence. And then number three, it's all about making sure that you are focusing on what is best, not only for the patient, but also for the company. So we talked about excellence just with yourself, right? But if you notice that something's wrong in terms of fraud in the company that you're working with, you better run. You better skip dodge. You better either, number one, make sure you alert. If you see something wrong, you better tell somebody. You better let them know, hey, this is wrong. This is wrong. Stand up and say this is wrong. If they fire you, hey, you can go to bed at night knowing that you did what is right and you're not in jail, right? So I would say if you notice something wrong, please speak up, because you may be alerting someone who is ignorant, and they also may not know that, oh my gosh, I'm doing something wrong. And you can educate them and you can make it happen. You can correct it. And then also that not only will it correct the agency, but it'll help the whole organization so that everyone doesn't have to be in jail doing stuff that they didn't even know was wrong because they didn't know the regulations and they weren't doing things with excellence. You understand what I'm saying? So, yeah, please speak up. So that's all I got to say. It was just kind of heavy on my heart, and I wanted to talk about it, wanted to chat about it, chats with Charles. And I got to get back to work, and I need to go home and take care of my wife and kids. So I will see you guys later. If there's another thing that comes up in the topic that I want to talk about, I'll just hop on here and we'll chat. So hope you guys are doing well. Make sure you're focusing on the patient. Make sure you're doing things with excellence. And please speak up. Speak up when you see something that's wrong, because healthcare fraud is a big deal. $27 million that could have been used by Medicare on patients that really needed help, and someone abused that for patients who really didn't need it, or they were billing fraudulently. And y'all,